Now, joining me now is Dr. Sanjeev Bagai. He is the chairman at Nephron Clinics. Also with us is Chandra Bhushan, CEO, International Forum for Environment, Sustainability and Technology, iForest as it's called. Dr. Bagai, the first question really is to you. I don't know about your weekend, but the weekend that just went by got so many people sick. So many people run to the hospital, and what I am hearing at least is that the numbers, when they crossed 1,000, that's when you immediately saw an impact of emergency rooms. You immediately saw patients sort of trickling in. What was your experience?
Good evening. I think this is a healthcare emergency in the national capital. There is no question about it. We have framed our rules of putting the GRAP measures in different grades to suit our convenience. Then the international AQI, which is recommended by WHO, is 15 and below. India has accepted 50. Okay, that's fine. But according to me, health hazards kick in anything more than 100 to 200. If you're going to wait for 400 to 500 to kick in and then bring in the measures, it's too little too late. Let me explain this in layman terms. This AQI is a reflection of various components of the air pollution, which is mainly PM 2.5, PM5, but not to forget micro nanoparticles of plastic, hydrofluorocarbons, volatile organic compounds, toxic gases like methane and so on, including ozone. These are filtered down in ultrafine particles. They break through your lung barrier and enter the bloodstream and go to every body organ. There is almost an 80 to 100% increase in lung cancers, brain cancers, kidney cancers, liver cancers, and so on in the last 10 years to 15 years. We've seen acute respiratory problems, including bronchitis, pneumonias. Children are more affected, especially because they breathe twice as fast as adults. That means they take in twice the volume of the pollutants. Apart from that, we must understand that 20% underestimation of the AQI is an accepted norm because the PM 2.5 aggregate as larger particles is called as an aggregating factor. So the real, if it is 500, the real is more than 650. Also, the heavy metals are never being spoken about. The heavy metals, what they do is they catalyze the micro nanoparticles of plastic, make them into super ions, and these damage the body even more. So we need to look at this in a more holistic manner. I have recommended this for a very long time as a simple tax-paying citizen, that we need a separate ministry of clean air. This is our fundamental right. If we want to reach the dream of being Viksit Bharat and a really strong nation by 2047 or earlier, we cannot achieve this if we are an unhealthy nation. Make no mistake about it, this is damaging the pregnancies, damaging the fetus, congenital birth defects, including absent limbs, cleft palate, congenital hearts, absent kidneys. It damages your DNA. That means your next generation is going to be born with more amount of chromosomal defects. This is all published data. There is some whispering in some corridors that all this is not correlated with the Indian study. So just in 60 seconds, let me pan it out. Sorry for my cough. This is a gift from the air. That there is more than 7,000 articles which have been published internationally, out of which more than 250 are only India-based. Lancet July 24, Lancet Jan 21, Lancet December 22, Lancet December 22, Lancet July 22, BMJ, British Medical Journal in November 23, New England Journal of Medicine 11/22. These are all published on India meta-analysis of 10 cities, 21 cities. Some are only based on Delhi. The fact is, even a 10 microgram increase in AQI of PM 2.5 gives you a 200% increased risk of either having a heart attack or a stroke, obesity, diabetes mellitus, metabolic disturbances. One notch higher of 22 AQI increase is equivalent to smoking one cigarette for a never smoker. That means with this AQI, on a daily basis, people who've never touched a cigarette are smoking up to 25 to 30 cigarettes a day. So in my language, it's called as welcome to the Marlboro country.
Dr. Bagai, I hear you. I hear the cough, the pollution cough in your voice. I hear your frustration. I hear your almost breathless list of things that is going to happen to us and the generations that follow. But somehow, the politicians are not hearing you. Somehow, our ministers don't care enough about AQI. Somehow they are perhaps in filtered air, and that's why it's not impacting them. And for some reason, this is just not knocking the right doors, which is really, really sad. But let me bring in Chandra Bhushan at this point. Mr. Bhushan, the last weekend is where a lot of people who were saying, "Arey, ye to bas hawa hai." A lot of people who in India have now discounted air pollution as just another inconvenience that you live with, right? Like you live with bad traffic, or you live with like bad water and you have to purify it at your own house. You just live with bad air. Like that's what a lot of people had sort of given up, and that's what they were living. Last weekend changed something. Friday, Saturday, Sunday, when numbers went above 1,000, something happened. First up, could you tell us what is your own analysis on forecast for the days and weeks to come? Remember, the days and weeks to come are going to be filled with Christmas parties and New Year end parties. There'll be catch-ups, there'll be weddings and receptions, there'll be a lot of gathering and also a lot of traffic on the road.
So we are right now in one of the worst meteorological conditions that you can think about. The wind speed is very low. You have inversion. You have high moisture, therefore you have fog. And it is both because of local conditions as well as the conditions from western disturbance. So what you see today is one of the worst meteorological condition clubbed with major pollution sources from everything. Whether it is traffic, it is heating and cooking fuel, industries, dust, everything has come together. And therefore you have such poor air quality. Next couple of days, the predictions are that the meteorological condition is not going to improve significantly. So you will have poor air quality for a couple of days. Let's now pray for gods to give us higher wind speed or maybe a rainfall to clear this up. No measure of GRAP can reduce this air quality, improve this air quality. I want to say it upfront. There's enforcement challenge of GRAP. I saw one of your reporters at Anand Vihar and how difficult it is to enforce. So one is enforcement challenge. Second is, even if we are completely implementing GRAP, will it get us very clean air? Most likely not. It will reduce somehow, but not significantly. So air quality in Delhi will not be improved by such emergency measures as GRAP. We have to start thinking about air quality improvement year round and start thinking about all sources of pollution. Start thinking about the entire region. It is not Delhi's problem alone. Yeah. You go to Noida, you go to Gurugram, you go to Aligarh, Meerut. You think
in
about.
In fact, let me go beyond that. It's not just Delhi, NCR, it's 60% of the country. 60% of the country has bad air. And that's the reality of the day. That's what we're dealing with. That's what we're dealing with. I really wish I had more time, Mr. Chandra Bhushan, but I promise I will not leave this issue. I promise we will come back to you and we will pick up different layers of this entire air pollution fiasco, emergency, that we've been talking about. But I'm really sorry, that's all the time we have at the moment. Quick wrap, and we will see you again tomorrow. Bye-bye.